Dr. Seth Berkley, Ministers of Finance and Health, distinguished participants, leaders of commerce and business, and ladies and gentlemen. Allow me, as we start this occasion, to begin by expressing my appreciation to the Secretary General of the United Nations, Mr. Antonio Guterres, for his contribution to this meeting in the form of a recorded message. He has provided outstanding leadership to the global community as we deal with the health, humanitarian, economic, and human rights crisis that COVID-19 has posed. His guidance has been a reassuring constant. It has enabled us to develop policies and mechanisms, not just to weather this storm, but to also prepare for future ones. I'm also appreciative of the presence of Dr. Tedros Ghebreyesus, who has led the global health response to COVID-19 pandemic. The support provided by the World Health Organization has been vital to effective continental, regional, and national responses. Colleagues, the pandemic has caused great devastation on our continent. To date, we have more than 3.4 million confirmed cases and have recorded nearly 87,000 COVID-19 deaths. From the early days of this pandemic, we have worked as the African Union to develop an African COVID-19 strategy, ably led by Africa CDC, with Dr. John Nkengasong at the helm. We were able to strengthen the efficacy of our COVID-19 strategy by setting up a medical supplies platform to enable African countries to procure medical supplies at affordable prices. And this was led by Mr. Strive Masiyiwa. A number of African countries that produce medical supplies were able to use this platform to sell their products across the continent. This in many ways enhanced African economic integration. We have promoted public health measures that depend on individual behavior and implemented regulatory strategies, including lockdowns in a number of countries to ensure social distancing. The most important public health measure to prevent COVID-19 is a vaccine. For the past year, efforts have been underway to find vaccines that are both safe and effective. We finally have achieved the goal, with a number of vaccines having undergone clinical trials and passed stringent safety tests. Now they are being produced in a number of places. The task before us is to step up global solidarity to ensure equitable access to the vaccines. All countries must get vaccines and must get them speedily. It is vital to the global containment of COVID-19 that vaccination takes place in all countries and among all populations. No part of the world will be safe from COVID until all parts of the world are safe. We are all aware of the challenges of accessing vaccines for the global south, particularly for Africa. The developed north, which has substantial financial resources, has purchased the largest stocks while we in Africa are struggling to get our fair share. The painful irony is that some of the clinical trials for these vaccines were carried out in Africa. And now we cannot get access to the very vaccines that were tested on us. In other cases, vaccines are packaged right here on the African continent, yet we struggle to access them for our populations. Vaccine prices are high, and many countries may not afford to vaccinate enough of their population to achieve herd immunity. I'm therefore pleased that we have both the President of the World Bank and the CEO of Gavi present with us. We know that there are ways of reducing the costs of vaccine production. Together with India, South Africa has proposed a TRIPS waiver in response to the pandemic. We are calling on the World Trade Organization to waive specific TRIPS obligations related to the prevention and treatment of COVID-19 for a defined period. We need more countries to support this initiative. This would enable countries in Africa and elsewhere to access active pharmaceutical ingredients and benefit from technology transfer, including the know-how to manufacture vaccines in Africa at a much cheaper cost. Earlier this month, I convened a meeting of the African Union Bureau to discuss the work undertaken by the African Vaccine Acquisition Task Team that I put together, which is led by Mr. Strive Masiyiwa and Dr. John Nkengasong. The task team was set up to ensure that the African continent would secure sufficient vaccine doses to achieve herd immunity. And we are talking about a continent of 1.2 billion people. It is estimated that Africa will only be able to access around 20% of vaccines needed through the COVAX facility. We therefore found it necessary to complement this facility to ensure that health workers are vaccinated soonest and countries reach herd immunity faster. We have secured a provisional 280 million vaccine doses for African countries through the task team. At least 50 million will be available from April to June 2021. These doses are from three major suppliers: Pfizer, AstraZeneca, through the Serum Institute of India, and Johnson & Johnson. Because of the high cost of vaccines, the task team has arranged with Afri-Exim Bank to support member states who want to access these vaccines based on a whole-of-Africa approach. Should countries submit firm offers, Afri-Exim Bank has committed to provide advanced procurement commitment guarantees, which is like a bridge funding of up to $2 billion to the manufacturers on behalf of member states. The AU team and the World Bank are collaborating to ensure that member states can have access to further funding. We appreciate the offer that has been made by MTN, a mobile telephony company on the African continent, to donate $25 million to the vaccine program of the Africa CDC to immunize health workers on our continent. This is solidarity in action. And we call upon other companies, both of African origin and offshore companies that do business in Africa to do what MTN has done to contribute financially to enable African countries to immunize their target groups. We truly applaud MTN for this gesture. It is against this background that we have convened this webinar to discuss the continent's state of readiness to deploy COVID-19 vaccines effectively. We will need to examine issues such as the financing and streamlined regulatory processes, reliance mechanisms, logistics, human resources, the governance of the whole process, communication, community engagement strategies, and country readiness. It's a huge task. We need to discuss innovative solutions to leverage different rollout capacities, including opportunities for collaboration with a range of private sector role players. We're pleased to know that many companies operating on our continent are willing, prepared, and ready to lend assistance to this whole effort. With the progress made towards the acquisition of vaccines for the continent, we look to this meeting to identify the next steps we should take to ensure the rapid deployment of vaccines to the eligible populations in the various countries of our continent. And with these words, I would like to welcome you all once again and look forward to our engagement. And it therefore gives me a great pleasure to ask the Chairperson of the African Union Commission, His Excellency Moussa Faki Mahamat, to make his opening remarks.
Of South Africa. Secretary General Antonio Guterres, Director General Dr. Tedros, President of the World Bank David Malpass, AU Ministers of Health, AU Minister of Finance, AU Commissioner of Social Affairs Amir Al-Fadil, Dr. John Nkengasong, Director of Africa CDC, ladies and gentlemen. The year 2020 was marked by the COVID-19 pandemic and has badly affected the health systems and the economies of all countries across the globe. In Africa, in particular, the pandemic has reversed many of the gains achieved in the implementation of our development agenda, Agenda 2060. Looking back to the past year, you have seen the devastating impact of the pandemic in our member states. And yet, you have also seen unprecedented levels of cooperation that will help us overcome this crisis. I am convinced that we will emerge even stronger if we continue to pursue and deepen this approach. From the outset, vaccines have been a critical part of our response strategy. In the lead-up to the World Health Assembly in May 2020 last year, the Chair of the Union, His Excellency President Cyril Ramaphosa, international agreement that guarantees equitable global access to vaccines as global public goods. Consequently, Africa CDC undertakes the African Vaccine Development and Access Strategy, which aims to eliminate the disease on the African continent by achieving population immunity, which means ensuring at least 60% of our population have vaccine protection to stop transmission and avoid future outbreaks. The importance of this goal is becoming even more obvious today as vaccinations campaigns are starting and discussions regarding travel restrictions for unimmunized persons are becoming more frequent. The leadership and commitment displayed by President Ramaphosa as chair of the Union since the beginning of the pandemic has been nothing but extraordinary. And it is my firm wish that he continues as AU champion for Africa's COVID-19 response beyond his tenure as chair of the Union. Excellences, Mesdames et Messieurs, pour soutenir l'accès
Excellencies, ladies and gentlemen, in order to ensure easy access to vaccines, the African Union has put in place, such on 7th November 2020, a special work task force for the acquisition of vaccines. This team is specially charged to acquire funding and procurement of vaccines for the continent. The recent announcements made with the intention of making an acquisition of 263 million vaccines, 50 million of which will be available from April, testifies to what we can do in collaboration and in solidarity with ourselves. The next stage of this is collaboration with other bodies like that of COVAX, which will be a crucial part in this effort. Collaboration and solidarity will be vital in order for us to succeed in this endeavor. Generally speaking, through vital international cooperation is necessary. And considering the rapid spread of this pandemic, no country will be in health safety without this collective effort by all countries. I wish to commend the United Nations, the World Health Organization, the World Bank, and other partners who have constantly advocated the cause of Africa in the fight against COVID-19 and who have financially supported us materially. Before I conclude, I wish to thank you all for coming together to ensure rapid and effective deployment of COVID vaccines in Africa. I thank you for your kind attention.
I welcome your invitation to join